Kid Leroy on your Born Lifestyle Station, City 105.1,000 miles. Okay, 10:10 is the time right now in the city of Lagos today, Friday, the second day in the month of September 2022. A good day to talk about an issue, and of course, something that concerns everyone, regardless of whether you're affected or not. Yes,
That's
and we're
true.
so excited to have Korede Akindele, a representative of the Dorcas Cancer Foundation, with us this morning. How you doing?
I'm good. Good morning.
Good morning to you, Korede
Good morning.
Akindele, and welcome, of course, to Breakfast in the City. Now, let's go straight into it. I mean, tell us what the Dorcas Cancer Foundation is all about.
Okay, thank you so much for having me, and thank you, City FM, for having us again this year. The Dorcas Cancer Foundation is a non-profit organization for children with cancer.
Okay.
We are 7 years this September.
Congratulations.
7 years. So we call it 7 years of gold.
Hmm.
And then for that 7 years, we have worked with over 60 children.
60.
Children, direct funding of their treatment, from diagnosis to the point of survival.
Yeah.
We are glad today that we have over 8 survivors.
8 survivors.
Yes, and then we still have some on treatment, and then we have the other stories. And we've led diverse projects, awareness, advocacy. We've led the first research for childhood cancer in Nigeria. We've trained over 2,000 healthcare workers at different levels. Because for us to be able to achieve what we actually want to achieve, training and research is so important in the work that we do.
Yeah.
So to hit early detection, so that's what we do, and then media awareness every year with City FM like this has really helped us educate and sensitize the public about childhood cancer.
Fantastic. All right, so I remember vividly the conversation we had from the representative of the Dorcas, Cancer Foundation. It wasn't you, but someone else. I really cannot remember her name now. But then they brought Timothy along
that was in
with the
February.
dad. It was in June. It was in June.
It was in June, yes.
Yes.
Survivor.
Yes,
Guides,
and
yeah.
it was just quite enlightening and quite inspirational to see how much work the Dorcas Foundation puts into ensuring that they fight it through with the children and the parents as well, because
Yes, yeah.
he came with his dad.
Yes.
And it was such a journey, and it was so good to witness all of that. Well done.
Thank you.
My memory is just trying to remember
Now,
right now.
tell us what's looking like when it comes to statistics as regards, the percentage of, Nigerian children who are cancer patients.
You see, it's growing globally. Over 400,000 children have been diagnosed every year, and countries like Nigeria, LMIC has over 80% in that.
80%.
Yes, over 80% of
Right.
that, and the number is alarming. It's growing every day. Now, it's as a result of late diagnosis. And why is late diagnosis? Because of people not picking signals earlier. There are different factors towards it, but one of the factors that we have seen is lack of education, lack of awareness, even by the children, and that's why for us. And we've seen cases whereby a child is repeatedly sick, and the child is going to the hospital, and maybe they've treated malaria for like 6 months before someone said, let us look again, what is happening? And then they begin to say, okay, let's go to a tertiary institution where proper diagnosis. So the case is growing over 80%. But as it is going to, we're trying as much as possible to educate. Now, the education for us is not just about general public. It's even about the healthcare workers, people who are the first primary care call when a child is sick.
Yeah.
These are the people working in private hospitals, people working in primary healthcare centers, and so we pay more attention to them to develop them. That look, when you see something, don't just commonize it as okay, it's a general illness. Refer the child to a proper pediatrician, and we have seen this done not just about cancer only. Because when the child goes to a proper pediatrician, the child gets a proper care. So it might not be even cancer, it might be other illness. So the child gets into the right person to take care of the child.
Fantastic. It's your number one lifestyle station, City 105.1. We're having a conversation with Korede Akindele, representative of the Dorcas Cancer Foundation. So I know the Dorcas Cancer Foundation is all about, enlightening the public, ensuring that they also, get the healthcare workers, information on how to handle the situations. What else is the Dorcas Foundation doing?
Okay, fantastic. At the Dorcas Cancer Foundation, what we do is just we call it our 4 core areas.
Right.
We call it REAP, REAP.
REAP.
Everything we
Okay.
do is around that. Number
Okay.
one,
Okay.
the R is research, which is so important. We launched our research over 5 years ago, and we have the second one going. Now, we can say the research is like the ones outside the country, but what we're trying to do is just to at least let's get figures, let's know the numbers we are seeing in Lagos, in every other state.
Yeah.
So that's all the research, and that's what we are doing. And the second is the early detection. Now, the early detection is as a result of awareness, just like this. Early detection are educating the healthcare workers, educating the general society, educating parents that when your child is sick, you take them to the hospitals.
Right.
And another one is accurate diagnosis.
Okay.
Accurate
Diagnosis, that is the A, which is so important
Hmm.
because you can say, okay, we've seen cases whereby wrong diagnosis was presented, and this child has gone through chemotherapy for a period of time, and then before someone says this child is not getting better, what's the problem? Let's check it. Let's check this. I said, this is the cancer. This is not the cancer. So that's another part that we're working on. We make sure children go through proper laboratory for their test. We make sure they get the right test, even if it costs us some good money.
Yeah.
But we stand there and we make sure that. And the last is prompt and proper care,
Hmm.
because care can be proper and not prompt. Prompt and
Early,
proper care.
you have to do it early enough,
the
yeah.
child, when the child needs to come, and sometimes and this prompt and proper care for us is so great. To child be able to take care of the child, give the child the drugs that he needs. So also, we didn't just stop there, because even after treatment, you saw Timothy the last time he was here,
Yeah.
and that's what made us launch a project with our survivor programs. And this month, that's one of the major things we are launching. We call it Back to School program for children that survive cancer.
Wow.
Because
Okay.
all through the time they don't go to school, their parents have spent a lot to get them back to school. It's it's not easy. So what we are doing is we try to partner with schools, private schools, to get them. We're successful. We have few kids that are enjoying those benefits now.
Nice.
One of our
Very
kids, got it all through his primary to secondary. He got it again somewhere. Somewhere is in a boarding school, courtesy of one of our partners. So we're calling on private school owners to support this project for children that survive cancer so that they can get back to school. So those are one of the things we are doing. Those are one of our major focus this month, and that's why we say childhood cancer, it's a national priority. Everybody needs to get it.
Everybody
Now, you-
needs to be part of it.
You spoke about early detection
Yes.
earlier and how important it is. How accessible is it to have or to get laboratories where children can be tested properly in Nigeria?
Okay, now the thing
And
is,
what's is it affordable?
okay, yeah. Let me first start. When you say testing, let me just break it down. Okay, for childhood cancer, there is no screening.
Okay.
It's just paying attention to signs and symptoms
Okay.
in a child. So when you see, for example, there are some signs you look at as a child when your child is not going well. Every parent knows their child. But when you discover that something is wrong, this child is not as active as it was, when you start taking the child in and out of hospital every 6 months, treating malaria, typhoid, do it. So that's that. But to say in Nigeria, we have centers that run normal check-ins across the state. For example, in Lagos, this is where we are. Though in other states too, they have few ones. But in the terrain that we work in, even outside the country, we have centers, good diagnosis centers that do well tests, and even we have the tertiary institution across the country. For us in Lagos, here is Lagos University Teaching Hospital, where it has a dedicated pediatric center. And to say quickly that a child that has cancer should be treated in a dedicated pediatric cancer center where they have all the disciplinary, where they have all the experts to handle the child. It's not something that will be done in one small hospital. It should be treated in a hospital where there is dedicated pediatric center. And for Lagos, we have LUT, and then in Abuja we have the national hospitals, and also in other states where there is teaching hospitals.
All right. Congratulations once again to the Dorcas Council Foundation. 7 years is no joke.
Yeah.
And obviously there's been challenges, and I'm aware of that. But then we want to focus on the good strides
Yeah,
and the
good side,
positive
yeah.
impact
Yeah.
you're making in the society. So
Yeah.
if people really want to, just lend a helping hand, they want to be a part of it, support this good work you're doing. How do they, be a part of that?
All right. Quickly, all you need to do is to just check our website. That's www.tdcf. T for D for Dorcas, C for Cancer, and F for Foundation.ng. Or you can tweet on social media, the
Yeah.
Dorcas Cancer Foundation. You can call us on our phone numbers, which is 09080471209. 09080471209.
Okay, so I think now I have an idea of how people say, baby, sounds like you're on the express, take it down. So you have to,
Exactly.
take a
Take it
chill
easy.
pill. So people really would just want to punch in these digits one after the
Okay.
other. So just, calm down. Yeah.
So can I go again?
Yes, please.
Please.
Okay, 09080471209.
Yeah. Okay. Fantastic.
Okay. All right. So thank you so much,
Thank you
Corey
very much.
Akindele, for coming through. And I must say that what you guys are doing at the Dorcas Cancer Foundation is amazing, and we wish you nothing but the best.
Thank you
And
so
we
much.
hope that someone out there would be willing to reach out to you guys, lend a hand out there, because the truth is the Doctors of Cancer Foundation cannot fight this battle alone. They need all of us. Even if you cannot, maybe support financially, you can just be on the lookout for
And
people's
this
children.
month we have some quiet activities that people can get in touch.
Okay.
Just on our social media, there are frame designs
Okay.
that you can just put on your social media with your picture to
Okay.
raise awareness. You can
Fantastic,
check also to
fantastic.
share the post. I mean, it's not just about money; it's about
sir.
awareness. Everybody, and I mean, let me just say before I wrap up quickly. City FM, thank you so much. Consistency, support. I mean, for us, it's huge. We know what it is all about, and that's why we are grateful. Every year, February, June, September, it's amazing to us. Thank you, City FM. Thank you, management of City
You're
FM.
welcome.
You're
And
welcome.
wonderful people that are here in the studio. Thank you.
We are definitely going to be doing something super amazing later with the team of the Dorcas Cancer Foundation. Check out our social media platforms for that, because it's going to be recorded for the children.
Mhm.
Remember to also, be a part of the conversation. If you want to make inquiries whatsoever, call the number 0908 0471209. They also have a website. It's www.tdcf.ng. Fantastic.
Thank
All
you.
right.